Welcome to the deep dive. So you reached out, and it sounds like you've been dealing with that feeling of just not being quite right, and maybe also a sense that some habits aren't really helping your well-being.
Yeah.
So for this deep dive, we're going to focus on understanding that. You shared a couple of really great resources. First, there's this comprehensive piece from Medical News Today that really gets into why someone might consistently feel sick.
Uh-huh.
And we're going to pair that with insights from Science Direct Topics, which gives us a sort of broader scientific look at what unhealthy behaviors actually means.
Right.
Our goal here is basically to connect those dots for you, explore why you might be feeling this way and how it could connect to, bigger patterns in our lives. We've got the detailed health stuff and the science behind our actions. So should be able to look at this from a few different angles.
Exactly. You've given us a fantastic starting point. That Medical News Today article, it gives us a really close-up view of the possible causes behind feeling unwell all the time. And then the Science Direct stuff offers this fascinating look at the underlying drivers, the influences shaping our choices about health behaviors. So we can think about both those immediate physical feelings and the bigger picture of how we live. And it's worth remembering, like the Medical News Today piece says, the CDC estimated that a lot of American adults, something like 60% back in 2019, were living with at least one chronic condition. So feeling sick persistently, it's unfortunately kind of common.
Okay, let's start by really digging into this always feeling sick thing, using that Medical News Today article as our guide. It lays out a pretty big list of possible reasons. First one they highlight, infections.
Right.
Now, we all know what it's like to catch something, right? Bacterial, viral, maybe even fungal. Food poisoning is a classic example. You feel awful suddenly.
Oh, yeah.
But the article also points out that some of us are just, well, more likely to run into these infections, like if you work with kids or in healthcare or live in close quarters, dorms maybe.
Or even just traveling a lot on public transport.
Exactly. You're just exposed to more stuff.
That's right. And the article's pretty clear on the basics for managing these,
Yeah.
Rest fluids, let your body recover mostly.
Sure.
But they also stress those key prevention things. Good food safety, washing your hands, covering coughs and sneezes. Seems basic, but that's our main defense.
Right, right. Okay. So moving on from infections, the article talks about digestive disorders. And this is a whole range of conditions that can leave you feeling kind of consistently off things like hiatal hernias, gastritis, stomach ulcers, GERD.
Which is gastroesophageal reflux disease, yeah.
Right. And even SIBO, small intestinal bacterial overgrowth. Sounds like these are often ongoing things that can really mess with how you feel day to day.
Yes, and with digestive disorders, the Medical News Today piece stresses that treatment really depends on the specific diagnosis. But generally, it's often a mix of lifestyle adjustments, maybe diet changes, stress management, and medication to tackle the actual problem.
Okay. Then we get into immune conditions. And this is where it gets, really interesting. The article explains how autoimmune conditions can actually mess with your immune system. So instead of just fighting off germs, the body kind of starts attacking its own healthy tissues.
Yeah, it gets confused.
Which can make you more likely to get sick and take longer to get better. And the list of examples is pretty long. Lupus, HIV, celiac disease, IBD, inflammatory bowel disease.
Asthma, allergies, type 1 diabetes, MS, Graves' disease. It covers a lot.
And the symptoms can be really varied too, like just feeling tired all the time, rashes, trouble sleeping, stomach issues.
What's really insightful there is how these conditions can show up as just that ongoing feeling of being unwell. It's not always like a specific illness you can pinpoint, but more a general malaise, low-level sickness. And the article correctly points out, with autoimmune conditions, the main thing is medical treatment and keeping an eye on it consistently. Often, there's no quick fix. It's about long-term management.
Okay, now this next one, anxiety. A lot of people might not immediately connect that with feeling physically sick,
Right.
but the article makes a clear link. It explains how anxiety can definitely cause physical symptoms like that yucky feeling of nausea. And it can even indirectly impact things by maybe affecting your immune response. They also list other anxiety symptoms: sweating, feeling short of breath, dizzy, heart racing, shaking. And they mention different types like generalized anxiety disorder, GAD, where you feel anxious most days.
Or months, yeah.
And specific phobias, too.
This really highlights that powerful connection between our mind and body, doesn't it? That nausea when you're anxious. It's not just in your head. It's a real physical reaction.
Totally.
And the chronic stress that often goes with anxiety can build up and affect your physical health over time. The article also gives a good rundown of treatments for anxiety lifestyle tweaks, like looking at substance use or relationships,
Right.
therapy like CBT or IPT,
Hmm.
cognitive behavioral therapy, interpersonal therapy,
Hmm.
and even meds like beta blockers sometimes.
Yeah. And speaking of stress, the next point is chronic stress. This isn't just about, deadlines or brief pressure. The article explains how long-term, continuous stress can really take a toll on different body systems, immune, nervous, hormonal, even cardiovascular health.
Yeah, it's pervasive.
And the symptoms they list are broad feeling drained all the time, digestive problems, insomnia, more anxiety, muscle aches, headaches. It really paints a picture of your whole system just being under strain.
Absolutely. Chronic stress basically keeps your body on high alert, which just isn't sustainable long term. The article suggests a crucial first step is figuring out what the specific stressors are in your life.
Resets.
And while you can't always just get rid of them, they mention good strategies like therapy, especially CBT, to help manage your reactions to stress. They also highlight mindfulness and, importantly, seeking support from others.
Okay. Then we move on to something we all know we need: sleep. Or maybe more accurately, what happens when we don't get enough good sleep?
So important.
The article really hammers home how vital regular restorative sleep is, mentally and physically, and sleep deprivation. It can lead to some pretty big issues, including, and this ties right in, stomach discomfort and being more likely to catch infections. Plus, slower healing when you do get sick.
Yeah.
They also list other stuff like higher blood pressure, joint pain, feeling sleepy during the day, fatigue, trouble concentrating, being irritable, even anxiety and depression symptoms.
It's so easy to underestimate just how much poor sleep affects everything.
Your body really uses that time to repair and regulate itself on so many levels.
Right.
When you're consistently short on sleep, different systems can start going haywire, contributing to that general feeling of being unwell and making you more vulnerable. The article offers some helpful, practical tips for improving sleep, like a consistent schedule, making your bedroom comfy and dark, dealing with any underlying medical issues, and being mindful of caffeine, especially later in the day. Okay, we're covering a lot here. Next up, poor diet and dehydration. It kind of makes sense, right? If you're not giving your body the fuel and fluids it needs, it's going to feel stressed and not work right.
Definitely.
The article lists a bunch of problems, from malnutrition and dehydration, feeling generally sick, nausea, vomiting, fatigue, dizziness, weaker immunity, even losing weight without trying.
Yeah.
And they make a good point about water. The whole 6 to 8 glasses thing is a guideline, but your needs can really vary depending on how active you are or the climate, and they really stress the basics. A balanced diet is key.
This really just underlines how our everyday habits directly impact how we feel. Consistently bad nutrition deprives your body of the essential stuff it needs.
The building blocks, yeah.
Exactly. And dehydration can mess with everything from your energy to how well your immune system works. The article's focus on a balanced diet is crucial. It's not just calories, but getting enough vitamins, minerals, all that good stuff.
Now, this next category is alcohol, drugs, and medications. The article points out that all of these can have a pretty big effect on our physical health and can definitely make you feel sick. They give examples like side effects from some cancer drugs and how alcohol can mess up your sleep and your digestive system.
This is a pretty broad category, and the effects really depend on the specific substance. For prescription meds, the article wisely says, talk to your doctor about side effects. Maybe there are alternatives.
Good advice.
For things like alcohol or recreational drugs, cutting back or stopping is often key to feeling better overall. And I like that they included resources like SAMHT and the 988 Lifeline for folks struggling with substance use or addiction.
Yeah, that's important. And finally, in this section about why you might feel sick, they briefly mention pregnancy and morning sickness, which is, a very common physical reason for nausea and feeling unwell then.
Yes, it's an important one to include a specific biological cause linked to hormonal changes during pregnancy.
So we've covered quite a few potential reasons why someone might feel sick all the time. And the article also touches on the wider fallout from this, missing work or school, struggling with tasks, and how it can make it harder to keep up healthy habits, maybe leading to depression, anxiety, or more fatigue. It can become a real negative cycle.
That's a really crucial point. Feeling unwell constantly isn't just about the discomfort right now. It can ripple out and affect so many parts of your life, physically and mentally.
And the article wraps up with some really vital advice. If you're feeling sick consistently for more than, say, a week or two, Definitely check in with a doctor. Figure out the cause. Rule out anything serious.
Oh,
Because, yeah, getting sick sometimes is normal, but if it just keeps going, that needs attention.
totally. Trying to guess what's wrong yourself can be risky. A doctor can give you an accurate assessment and suggest the right path forward, whether it's treatment or lifestyle changes.
Okay, so that gives us a really solid look at the medical and lifestyle factors behind feeling always sick. Now let's shift gears and dive into the second part, exploring this landscape of unhealthy behaviors using the Science Direct Topics material. The basic idea here is these are actions or habits we do that can harm our physical or mental health.
Right.
And they list examples like smoking, drinking too much, drug abuse, reckless driving, that kind of thing.
What's interesting right away is that the chance of doing these things isn't simple. Science Direct stresses it's this complex mix of individual factors, the situation you're in, and the specific behavior itself.
And one area they dig into is the link between personality and unhealthy behaviors. It's not like this personality type smokes, but they do say certain traits in certain situations can make someone more likely to engage in unhealthy stuff and maybe less likely to do preventative things like using sunscreen or seatbelts or even basic hygiene.
Yes, and they introduce this really interesting idea of tropisms, kind of like how some plants grow better in certain soils. Similarly, some people, because of maybe their genetics, temperament, early experiences, family, peers, they might sort of gravitate towards environments where unhealthy behaviors are more common.
Oh.
They mention traits like impulsivity, maybe hostility, neuroticism. These could potentially lead someone into situations where smoking, drinking, drug use are more the norm. But on the flip side, positive traits might lead people to healthier places.
Right.
But, and this is crucial, they point out that having a genetic predisposition doesn't automatically mean someone will act unhealthy if their environment is actually supportive and healthy.
That's a really important difference. It's not just what's inside us, but also the world around us, the influences. And this next point is interesting. Unhealthy behaviors often kind of clump together. It's rarely just one thing.
Yeah, you see that a lot.
Science Direct suggests this happens for different reasons, maybe practical stuff like time constraints, how easy it is to get things, social dynamics where behaviors are linked, or even just underlying tendencies. I give the example. Drinkers are more likely to smoke.
Exactly. They often seem connected. And they also talk about this idea of cross-elasticity, where changing one unhealthy behavior can actually affect other unhealthy behaviors, sometimes increasing your overall disease risk in ways you wouldn't expect just looking at one behavior.
Huh. They also mention this difference between primary and secondary behaviors. The idea being, if you can target a primary bad habit, it might cause a ripple effect and reduce other secondary ones.
That's a really useful point when thinking about how to help people change. If you can find that sort of foundational behavior that drives others, maybe you can create more effective change strategies.
And the research apparently suggests that tackling multiple risk behaviors at the same time can often work better than just focusing on one.
Right.
They give an example. Quitting smoking and getting more active can lower heart disease risk more significantly than just quitting smoking alone. But they also admit it's tough for people to try and change multiple things at once. It can feel like too much.
That's the trade-off, isn't it? A big multi-pronged approach might have better long-term results, but the effort needed up front and to keep it going could be a huge barrier for lots of people. It makes you wonder how much change is realistic for someone to handle at one time.
Now, this next section connects unhealthy behaviors to the workplace, looking at occupational risks. They define a risk factor here as any unsafe condition or action that lets a hazard cause harm. And they distinguish between occupational illnesses, usually from long-term exposure to bad conditions and accidents, which are more like single events causing injury.
This is a really important area because where we work can hugely impact our health, both through sudden accidents and slower long-term exposures.
And they outline 4 main causes of workplace accidents and illnesses. First, management not really understanding or committing to safety.
Okay.
Second, the unsafe or unhealthy conditions themselves, bad lighting, clutter, whatever. Third, the source causes of those conditions like worn-out equipment or bad maintenance.
Right, the root issue.
And finally, unsafe or unhealthy acts. That's where human behavior comes, in workers not following safe procedures. They even link these acts to personal factors like being tired, maybe intoxicated, or just having a bad attitude about safety.
This breakdown really shows how risk at work is multi-layered. It involves the environment, individual choices, and how people are feeling or acting.
Then the discussion moves to behavioral medicine and how it tries to change unhealthy behaviors. They mention techniques like self-monitoring, basically, paying attention to what you're doing.
Becoming aware, yeah.
Stimulus control, which is managing the triggers for bad habits, and contingency management, using rewards or consequences to encourage healthier choices. And they say again that programs targeting multiple risk factors for things like heart disease have shown good results.
Behavioral medicine offers a really practical toolkit for tackling these behaviors.
Yeah.
These techniques are all about consciously changing things through awareness and using strategies to support better choices.
However, they also admit it's really challenging to change deeply ingrained habits, like smoking. They mention high relapse rates and stress how crucial motivation is for long-term success.
Uh-huh.
And they also touch on how hard it can be for people to stick to dietary changes. It's often way more complicated than just deciding to be healthier.
That really gets to the core of behavior change. A lot of these unhealthy habits are deep-rooted, tangled up with psychology, maybe even physiology. Overcoming them usually takes sustained effort, maybe multiple tries, and strong motivation.
And this leads to the idea that unhealthy behaviors can sometimes be like poor coping mechanisms for stress. Instead of dealing with the stress itself, people might turn to drinking or smoking for temporary relief.
This is such a common pattern. When we feel overwhelmed, we might reach for things that give immediate comfort or distraction, even if we know they're bad for us long term. It really highlights how important it is to address the source of the stress, not just the behavior.
They even briefly mention the psychophysiological link, how personality, stress, and health are connected, like the fight or flight response and how stress hormones affect the immune system. It all comes back to that powerful mind-body link.
It's a constant reminder that our psychological state has real biological effects. Chronic stress can indeed weaken our defenses and make us more prone to getting sick.
Now, this next bit gets into a more specific, maybe sensitive area: addiction and pornography use. They talk about the debate over terms addiction versus compulsive behavior.
Right, the labels.
But they stress that, whatever you call it, the potential for problematic use and negative consequences is real for some people. They highlight possible long-lasting effects of repeated exposure on the brain's reward system, and mention studies suggesting maybe changes in brain structure and less enjoyment in real-life interactions, possibly because arousal pathways get rewired. They even mention the Coolidge effect, where repeated exposure makes you need something more novel or intense.
This is complex, and research is still ongoing. The main takeaway seems to be that repeated exposure to certain intense stimuli can have lasting effects on the brain's reward pathways. And this can contribute to patterns of behavior that are hard to control and might negatively impact well-being in relationships.
Okay, broadening out again, the Science Direct stuff also brings in the vital role of social determinants of health, stressing how things like our environment and socioeconomic status heavily influence our health risk behaviors.
Yeah, that's huge.
They specifically note that adolescence is a really critical time when our surroundings can powerfully shape long-term health habits.
This is such an important perspective. Our choices don't happen in a bubble, right? Our communities, our financial situation, whether healthy options are even available, all of these factors play a massive role in the behaviors we end up adopting.
And they introduce social cognitive theory, which emphasizes this constant back and forth between our personal factors, thoughts, beliefs, our behaviors, and our environment. They also talk about peer influence, both who we hang out with and how they influence us, playing a big role in starting unhealthy behaviors, especially when we're teenagers.
Social cognitive theory gives a really useful way to understand how all these pieces, our inner world, our actions, the world around us, influence each other in shaping health behaviors. And peer influence, especially in those formative years, can be incredibly powerful in setting norms and swaying choices.
Finally, they briefly mention ecological models of health behavior. These take an even wider view, considering multiple levels of influence: the individual, their social networks, the broader community in shaping risky behaviors.
These ecological models offer a really comprehensive view, recognizing that to really tackle complex issues like unhealthy behaviors, we probably need to think about interventions at multiple levels, not just trying to change individual behavior alone.
So as we kind of wrap this up, it really seems clear, doesn't it? Like both sources highlighted, feeling always sick is rarely just one thing. It's usually this context mix of our physical health, our mental state, and our behavior patterns.
Exactly.
Yeah.
The Medical News Today article gave us that detailed list of potential physical and psychological reasons.
Right.
While the Science Direct stuff showed us the complicated web of factors influencing our health choices, which then feeds back into how we feel, physically and mentally.
And the key takeaway seems to be that to really feel better, you've got to address those underlying root causes, whether it's an infection, a medical condition, stress, lifestyle habits, or even the environments we're in. It's all connected.
Precisely. It's about taking a more holistic view
Mm.
and seeing how all these different parts of your life might be influencing your overall well-being.
So here's a final thought for you, the listener, to chew on. Given how interconnected our physical health, mental well-being, and behaviors are, what one small change in your daily routine, maybe sparked by this deep dive, could create a positive ripple effect? Think about which primary behavior, if you addressed it, might have the biggest overall impact on how you feel. It's not about trying to change everything overnight, but maybe finding that one key area where a small, consistent shift could lead to bigger improvements down the line.